I am not a pharmacist licensed in 4 states, but I am a pharmacist licensed in 1 province. Hi, my name is Ethan, and I'm a pharmacist practicing in Alberta, Canada. And today, let's talk about scope of practice. Scope of practice, in a simplified description, is basically what can the professional legally and competently do for you based on their training, based on the law, and based on the regulations set out by their professional college. So this doesn't necessarily have to be healthcare related, but in a lot of examples, it is. Doctors can do things only doctors can do. Nurses can do things only nurses can do. Pharmacists can do things only pharmacists can do. And that is within their scope of practice. But what makes this so interesting is just the sheer variability in scope of practice between different states and different provinces. So today I wanted to highlight the different scopes of practice of pharmacy in Canada. And I have a table pulled up here. I'll pull it up on the screen from the Canadian Pharmacists Association to show you. What you see in the second column here is essentially everything else a pharmacist could do in Canada, aside from counting the medications, putting it into a bottle, giving it to you, and telling you about it. Okay, so we have independently prescribing any Schedule 1 medication, prescribing in collaboration with, let's say, a doctor or a nurse practitioner, prescribing for minor ailments, for smoking cessation in an emergency situation, and then adapting prescriptions. So that means like the doctor or the nurse practitioner has already written a prescription, but now I need to change it due to whatever reason, if we don't have that formulation or the dose is inappropriate or what have you, or even extending an existing prescription that's run out of refills. In addition to that, we have administering medications, so drugs and vaccines and the flu shot. And then further down here, we have ordering and interpreting lab tests. Yes, some pharmacists in different provinces can do that. And having regulated pharmacy technicians that, again, have to go through schooling with a regulatory body and get their licenseship and all that fun stuff. And I don't mean to brag, but I'm going to brag. Look at Alberta, baby. Woo! It's all check marks across the board, and I think that's pretty darn cool. And I hope through hard work and public advocacy and time, really, that pharmacists all over Canada and all over the States and everywhere else in the world will be able to expand their scope as well to help as many patients as they can. Like, look what's going on in Northwest Territories and Nunavut. Right now, as far as I can see from this chart, now somebody please chime in if you practice in Northwest Territories, but if a patient comes in and something's wrong with their prescription, it sounds like they're going to have to go back to the doctor. Or at least somebody's going to be waiting on hold on the phone trying to get a hold of this doctor to make the changes that need to be changed. But on the bright side, they can extend prescriptions. But none of us having none of it. I'd like to know in the comments, what helpful experiences have you had with your pharmacist? What have they been able to offer for you with their scope of practice?